throughout. So let me see. So then, as well as you might want to ask the patients like, we're gonna set down a pricing sheet. We're gonna do that. We explain the constellation is gonna be $4,000. So that's how much the constellation fee for them, for them to get all checked in and.
Mom, what is it? She's in the room trying to eat it.
That's not nothing to play with. First of all, stop touching stuff. The consultation, and then you got the treatment plan range from and they say treatment plans range from $400 to $600 depending on your level of care product selection. So it means that we have some goods that's like $400 to $600. We review patients' conditions with them. We're pretty much going to be focusing on, what they may have going on, the expression. We're also going to be maintaining the professional and reassuring the tone as well whenever we're dealing with patients. We're going to explain if they have cancer-related symptoms, treatment focuses, as well as comfort and stability. As well as we're going to let them know we can manage, this can help manage pain and nausea and appetite loss and sleep and disturbances caused by the treatment as well. As well as we'll let them know that, this form includes symptoms, treatment history, and preferences. And we're going to ask them, if it's related to cancer or chemotherapy treatment. As well as we'll let them know, do you prefer edibles or inhalation for treatment? As well as you can ask the person. Hold on a second. So then we're going to review the patient. We're going to ask the patient what's their full name, their age, date, and their birth. We're going to have them type it in the chat, or they can say it. We would say this out when it's in the green, right? Then as well as, like I said, we're asking them what symptoms they're experiencing. And then as well as I'm going to also let them know I'm going to be referring you to our mental health unit for diagnosis, which is Dominique's. And you have Smooth. And that's the unit for diagnosis. It's basic so they can be clear before them deciding the treatment plan because they'll be undiagnosed. So like I said, they'll send them back over to us. We begin writing down all the patient's information, referral documents, and send it off to the form request to the contact patient. So like I said, once I get this patient in, we bring them in, we send over everything. Like I said, I usually send that over to Smooth or Ms. Dominique, and then I have them send it back over to me, and then we have that patient come back in and get their medical marijuana card. That's how everything will work on this, if everything go right with that first consultation. And okay, and then we let them know they've been informed about all med card warnings and everything like that. We gotta let them know that we informed them of the medical marijuana use. The intent to sell is illegal for Glendale. We also let them know, please, keep in mind that medical marijuana is not a cure. So like I said, we got that. I already said that. Okay. So, we got that. And then we also we write down all the acquired information and sends it out to one state Department of Health. Here's your outpatient packet and handbook. Go over these and you make it home to remember to come see us in 3 days for your results. Now,